the same. Ok. Pourquoi dis aux gens de. When you're ready, you.
Press here.
Yes, just like this. Okay.
دكتورة.
Oh, okay.
Can we call them to see at what point they are? We are really late. It's 11:20. Excusez-nous. Mais moi, je suis le maillon faible dans, dans cette histoire. Ah, d'accord. Tant mieux. Mais on doit terminer à midi, n'est-ce pas? On doit quand même dégager à midi. Ah, il n'y a personne après moi à midi ici. Ok.
How did you change now?
C'est du n'importe quoi. Ouais, il n'y avait rien, même pas le produit à injecter, c'est vraiment du n'importe quoi.
Mais c'est qui parle?
We'll do demo.
Can I take another look just to check some points? Okay, thank you. I will do it live so they can see. Enfin.
Start. Enfin, ça va commencer.
À faire quoi?
La présentation.
Mais on l'a pas, on l'a?
Ouais, j'ai entendu, on va commencer. Par contre,
I will go that way. Good morning, can you hear me? So good morning everyone. Today we're going to talk about the new body correction with the new era of body fillers. We're going to see the presentation together. Is it possible to see it also here so I can follow it? Okay, so welcome everybody to this session. Please, you can scan the QR code in order to get registered and get the certificate at the end of the session. You can get it directly at the booth of Dermaqual. So that's it. Let's go on. Next slide, please. So it's important to have better curves nowadays to get also a better self-confidence. The market is getting really bigger in this kind of view because body corrections is now one of the most, say, bigger industries in the aesthetic world. As I said, it's the fastest growing category. As you can see, the trend within some years is making a very big economical impact in the industrial and aesthetic world. This is an idea of how it's getting the growth since 2017 until 2029. So we are talking about almost 10 billion USD dollars by 2029. What patients are looking for through body correction? So they are looking for body augmentation, hands rejuvenation, the corrections of the dips and depressions of the gluteus area, reversing the sagging of the skin due to laxity and to aging, the final touch after some surgeries, the correction of some asymmetries, post-surgery corrections, calves enhancement, genital improvement, the treatment of some cases of cellulitis, all of this in a rapid, safe, and non-invasive way. So let's obtain the unobtainable, and this is gonna be thanks to the new era of the cross-linked body hyaluronic acid. We know that hyaluronic acid is a glycosaminoglycan, which is a natural component of our skin, specifically of the human extracellular matrix. It's a very nice technique because we don't have any downtime period. It's safe. The secondary effects are really very rare. We can get optimize and the treatment and get predictable results. Let's go on. So the characteristics of the filler will make the difference between one product and another one. In this case, our gold fill volume filler has a composition of course, cross-linked hyaluronic acid. The concentration is 20 milligram per ml. The particle size is around 600 microns. The BBDE, it respects the gold standard and it's actually less than 2 ppm. And the volume per syringe is 10 ml. It has, and I would like to underline this important aspect, a CE mark. So we are knowing what we are injecting and we have a very safety profile for us doctors and for our patients. The product advantages are reassumed in these 5 steps. So we have a biofermentation. The hyaluronic acid is obtained from non-animal hyaluronic acid through biofermentive origin. It's a novel technology, so as I said earlier, the BBDE quantity is very low, which is a safety profile for the patient. A formula optimization, non-allergic, it's of course absorbable and versatile. Homogenization and purification, so the raw material is of a very high quality. It's homogeneous and non-pyrogenic, and all of these lead to a product with a big safety and quality. So what makes gold filler volume so special? It's the latest technologies through its modulation. It's combining smaller molecules to the basis of 600 microns. It's a monophasic structure and it's advanced viscosity. The basis of our filler is 600, but it combines also 2 different sizes. So we have larger particles than 250 and over are more resistant due to their volume, whereas smaller particles around 50 to 100 microns are reabsorbed faster. The small molecules will permit to the filler in order to get integrated within the tissue, and the bigger particles actually will give us the longevity of the product and the results. It's very important to know that gold fill volume is a monophasic filler. So the monophasic structure is when we have cross links formed between hyaluronic acid change will form a unique uniform gel-like structure. Biphasic actually fillers can be interesting because of the free hyaluronic acid molecules that will recall the water and give a volumizing effect for the first 3 to 4 weeks. But then after the first month, this recall of water will flush away and the result will be a little bit disappointing. Whereas this is not happening with the monophasic gel, in this case, gold fill volume. It's very important also to talk about the rheological characteristics of our filler. We know since the era of the fillers that viscosity and elasticity are two important factors to take into consideration. As you see in the histograms, gold fill volume filler has the highest G prime, so it has the most important capacity of volumizing. Whereas in the lower histogram, you can see the elastic modulus, so the capacity of lifting the area of the gluteus. So we combine volume and lifting effect in a very interesting way. What are the application areas? So as said before, we can apply our filler in the hands, in the gluteus, in the calves, in the genitals, and in anybody that we have a depression. It could be iatrogenic or after a trauma, for example. What are the buttocks types? So today we have a consensus about 4 types of buttocks. The first one is the squared or H shape, the round or O shape, the hard pear A shape, and the inverted or V shape. The most common are these 4, and the most beautiful, let's say, sort of buttocks is the heart shape, the inverted heart shape, which is considered the most sexy and attractive kind of buttocks, whereas the most difficult and due to sagging and aging is the V shape. It's important also to consider some key points in the projection of our buttocks. For example, if we divide the buttocks in 3 horizontal areas, the highest projection area should be in the 2 upper thirds. It's also important to consider the ratio between the hips and the waist. Let's move on. So, what are our body sculpting techniques? Before doing any kind of treatment on our patients, it's very important to have a precise idea of the anatomy. So, I start from the deepest aspects to the superficial one. So we have the skeleton area of the gluteus, and here we have to take into consideration some key points for us to take into present with them when we do the injection. For example, the ischiatic tuberosity, the sacrum, and the iliac crest. Our muscles of this area are three muscles with the gluteus maximus, the gluteus medius, and the gluteus minimus. Concerning the nerves of the area is given principally by 2 nerves, the upper gluteal nerve, which comes from L4 to S1, and it will go to the medium and the minimum, and to the tensor du fascia lata. Whereas the inferior gluteal nerve will go to innervate our gluteus maximum muscle. Let's move on. This is a schematic picture of the nerves of this area. What about the arteries? The arteries are very important because just one second. Yes, they are very important because they are big branches of the internal iliac artery. So we have 2 main arteries of the gluteus area, the upper or the superior gluteal artery, which will go mainly with 2 branches, and it's the biggest branch of the internal iliac artery, and the inferior gluteal artery. They have horizontal traject along the muscle fibers. What about the preparation? So it's important to see the patient in a standing position that we will see together. We can go forward. Of course, we have to clean the area with an antiseptic solution. it's important to evaluate the importance of and the strength of the muscles, asking the patient to contract. I perform a 3D inspection of the patient, so from backward, from the side, and from the anterior aspect to see the projection in 360 degrees of the gluteus. We have some benchmarks that are important to take into consideration. For example, the T line, which is the vertical line that passes through the ischiatic tuberosity, and the M line that passes from the medium of the gluteus. These two lines are important because we will define the gluteal fold ratio compared to these two lines. Usually, a little bit of local anesthesia is performed in order to make the treatment more comfortable for our patient. We can use a 30 gauge. Personally, I only use lidocaine, but you can use lidocaine and adrenaline together. We will do especially a point in the entrance point of our cannula, and then you can do some points all over the gluteus, or you can do a fanning technique with the cannula, so you can numb all the area. I prefer not to exceed with the use of anesthetics in order not to alter the volumes of the area I'm going to treat. What's the technique injection? So these are, as you can see, the areas we can treat, A, B, C, and D. Most frequently, the treated area are A, B, and C. It depends on what we want to obtain or what we want to correct. So it's honestly a case tailored treatment. So you have to see if you have hip dips, so you can correct that part. If you want to project at 360 degrees, so you have to inject at 360 degrees. If you want to get a shelter in the upper part, so you have to focus on A and B. Usually, I inject around 5 syringes per side at the first session, but we'll talk about this later on. So, as you can see, we have a central entry point of our cannula. Usually, the cannula is long, 10 to 14 centimeters, so it can cover, with a fanning technique, almost all the area. Otherwise, we can use a secondary entry point. So this is the fanning way we were talking about, the upper side, so we can give a better projection of the 2/3 higher parts of the gluteus, the lateral side for the hip dips, the lower side, which is not my favorite one, and the 360 degrees, so we can give a full projection of the gluteus area. The injection technique, usually it's retrograde. The most used one is a fanning technique, but you can do a cross-hatching, you can do also retrograde simply. I do not usually use bolus techniques unless I am treating some depressions of severe cellulitis. Of course, the effects of the treatment depend on many factors of the quality of the material, the quantity we used, the technique of the injector, and the habits of our patient. Nowadays, the market of aesthetics is also getting a bigger volume in the intimate area. We know that fillers and specifically gold fill volume could be injected in the major labia in our female patients. So we can give a younger appearance after aging and sagging of this area. It's also interesting because it could lubricate the vagina and gives more comfort during sexual intercourse. Some talk about also the G-shot technique, so it's kind of treating the G point, which is 1 centimeter area in the anterior wall of the vagina, which is considered interesting in during the arousal of the sexual intercourse because it gets, let's say, bigger naturally as a volume during the intercourse. So we can treat also that area. Also in a menopause, so it could be more comfortable, or in the painful intercourse, it could help a lot to get a better quality of life. Let's see some case studies. So the results, of course, are visible since the first treatment. We don't need to do obligatory a second one. Let's see some before and after. You can see in the first case, we have a full gluteus projection, 360 degrees. In the second case, it's more a hip dip correction in order to give a fuller aspect from the posterior view of the gluteus. Again, 360 degrees. Again, a correction of the hip dips and the fourth case. Here, I treated a severe case of cellulitis in this patient that couldn't answer to any of the classical treatments. So I made a kind of subcision with the cannula, a big cannula, and then I injected in a fanning technique, fanning and the bolus, mini bolus technique in the big depressions, and a very slight volume, so to give a fuller aspect of the gluteus. And this was obtained with only 3 syringes. This is my patient of 70 years old. He underwent a cranial trauma, and which left this depression, and it gives him a big discomfort in his social life. So I treated the area with 1 syringe of gold fill volume. Another case of my colleague, Sam, with the treatment of the hands rejuvenation. So in order to get less apparent the ligaments and the veins of the hands, you can see already with the first session, the beautiful effect of gold fill also in the hands. Another case of gluteus augmentation. So if you have more curiosity, details, or info, you can get whatever you would like to inform about in this website. Let's pass to the live demonstration with my patient. So I will show you this our case. So I will please come here. If you can stand, okay, and take this like this forward, okay. Around. Let's make this like this. Just okay. So can we activate this camera? So tournez un tout petit peu comme ça. Non, comme ça. Okay, parfait. Ça, tenez ça comme ça. Okay. So in this case, you can see we have the hip dipples that I am going to correct in order, you can see from a lateral view, it's not full, so we need to augment this part and probably the upper side of the gluteus. So I will get a dermographic pen, please. So whenever I am evaluating my patient, I am evaluating first from a posterior view and second from an anterior and a lateral view. Okay. So in this case, the area to get treated is, I'm going to show you the and we will see together the benchmark. So I am going to trace a horizontal line that passes through the anus. So this is my horizontal line. And then another line from the most external part of the hip to this internal part. And this is the medium line, the M line we talked about. So my most projection of the gluteus should be in this area. I ask also my patient to contract the gluteus at the maximum so I can see where it attaches in order to get a fuller aspect also of this part, which will design a sort of shelf that is very appealing to the gluteus area. Contract again. Okay. So my entrance point, we have 12, I think, centimeters cannula. So my entrance point is going to be around this area. And then again, we will do a small correction of this dip, which also is present here. Okay, so now we will take a frontal look. So can you turn around again to 360 degrees. Okay, perfect. So from a frontal view, you can see that we have also some dimples in this area we can correct. And laterally also this, we can bring it forward to this part. So as you see, it's a 360 evaluation of our patient. We're not going to do a full gluteus augmentation, but the correction in order to get a more rounded and more projected gluteus and correct especially the hip dips. So now that we had the design, our patient can lay down. The head is up that way. Okay. I am going to perform 5 ml of lidocaine per side. So you will feel just a little puncture. I have a 30 gauge needle. You can do also the blanching technique when you see that the skin is becoming white. It will help us as a compression also for the small capillaries of the area. Is it okay?
Yeah.
Perfect. I will do it from the other side also. And then I will put some lidocaine in 2 to other 3 points just to make the treatment then more comfortable. In this upper area and laterally in this area. Okay, and now my second 5 ml. Are you fine? Okay. Same here. Okay. We will wait for just 1 minute. Meanwhile, I will change my gloves. So meanwhile, if you have any question, I can answer to your question. If you want to interact or have some curiosity, please ask me. Okay. Maybe not the okay, perfect. So I will use also some antiseptical solution again before starting the infiltration. Thank you. Okay. This is a 40 gauge needle, so I am going to make my entrance point. Tell me if you feel pain. Is it okay? Okay, so be careful when you do it. You have to be superficial. This is a risky area, so you have to be only superficial. As long as you are through the dermis, you can stop. So we can already enter with our cannula. Can I have some pads? Thank you. Okay. So I'm going to start my injection, always following my pre-work. So you can see I am injecting as if it's a mini liposuction. Is it okay? Creating some space, like a small subcision, injecting in a retrograde aspect. Is it okay? Perfect. As you can see, my second hand is also guiding my cannula. So I can feel and touch where I am going to inject. So first, syringe is distributed a little bit all over the upper area. So this will help me also create the space that I am going to fill later on. Is it okay? Yeah. Okay. One. So I am not really superficial, but of course I am not deep. I am injecting in the fat that is included between the superficial fascia and the deep fascia. This is the ideal area to treat. So it's that fat that is contained between the two fascias that should be aimed and should be treated in order to get the best results of our treatment. Ça va? Okay. Perfect, thank you. So I will go on the same area. I want to enhance it a little bit more. So as you can see, I'm not putting any force for the protrusion of my product. Because of its rheological characteristics, it's very easy to manipulate. Especially if you are using a big caliber of cannula. So almost as a face filler. A little bit of more pressure, but that's it. Is it painful? Okay. So as you can see, I used only 5 ml per side of anesthetics. Of course, the patient can notice some pain or some pressure, etc., but it's only for a better result and a better safety profile also using less anesthetics. Okay. Can I have some betadine, please? Almost no bleeding at all. Nonetheless, I didn't use at all adrenaline, only lidocaine, pure lidocaine. So it's very important to respect our injection plan, which is fundamental, because if you inject in a more superficial plan, you will get some bumps and lumps, whereas if you inject deeply, then we will get the serious complications because of the nerves compression, the risk of embolism. So we have big arteries within the muscle or deeper. This is why my plan is always possibly in this area, which is contained between the upper and the profound fascia. This is our 4th syringe. So as you can see, I want to reach this area. It's a bit far away from my access point. I will do another access point which is more laterally. So I need again, please, some lidocaine. So my access point would be more lateral. And now I start my injection again to reach this lateral aspect of the hip dips. In this case, the dip is enough profound, so I can make some kind of small boluses in order to lift up this area, thanks to the high G prime, the highest G prime of the product. Ça va? I will put the 5th and last syringe. So meanwhile, if you have any question, don't hesitate. My second hand, the less dominant one, is always guiding my treatment. Okay, we're almost done. Voila. So now we will go through the right part of the gluteus. I just make some compression to be sure my product is not presenting like bumps. Now, if I touch my patient, I can feel this upper part that is very well defined, as if we created some kind of shelter, some kind of a shelf that is, from a aesthetic point of view, very interesting. Is it okay? Yeah. Perfect. Can I have some transparent antiseptic solution? Is it already on? Okay, perfect. Okay, so we will go through the other side. Same technique. You can feel that you are in the correct level because you don't have a big resistance, to the cannula getting forward. So you know that you are in a correct plan. This is not always true, because when you have patients that probably had undertaken other kind of treatments, you can find some fibrosis, so this could be tricky. So you are in the right plan, but the skin is fibrotic and the adipose tissue is fibrotic, so you do not know exactly at what level you are. Is it very painful? Okay, amazing. My second hand is always guiding my treatment, so I want to restructure this kind of projection of the upper part of the gluteus. As I said before, usually my first syringe, I use it to distribute it and create some tunnels for the following syringes. As you can see, I'm not making any kind of pressure, so it's really easy to manipulate. In case of severe cellulitis, before doing the injection, I use the cannula to inject my anesthetic and to do some subcision. So I destruct mechanically the subcisions with my cannula, a big cannula, and then I infiltrate the depressions of the cellulitis, as you saw in one of the laced cases, which is a very interesting treatment for resistant cellulitis. I will get a little bit from the other side so I can assess better the other area, the lateral area. Always follow your design, follow your project, which is very important, because when the patient is laying down, actually, as you can imagine, the distribution of the tissue is not the same as an upright position. So it's fundamental to follow our project. At a certain point of the treatment, you can ask your patient to stand up. This could give you a better idea of the result. Okay, a little pain here. As I told you before, like it could happen in some points. Is it okay?
Yeah.
Okay. Laterally, I can make some boluses. Okay, can I have a go? Thank you. It's the fourth one now. Okay. So fourth syringe. I think I will stop at this level because the left side was asymmetrical and was worse than the right side, especially laterally. So as you can see, the treatment is easy as long as you know the key points of the treatment. Physically, it's not difficult to treat because some female colleagues are afraid of the pressure they have to do in order to perform this kind of treatment. But as you can see, if you use a 16 gauge cannula, the product viscosity and the characteristics of the product can help you protrude it very well. I tend not to overcorrect because it's like everything in aesthetics. We always have time to overcorrect in a second step, but if we do it immediately, then we don't have the possibility to get backwards in the time unless we go through hyaluronidases enzymes, which is better to avoid. Okay, I will massage again. Also again, if we touch this upper area, we can see that there's a quite nice definition of this upper part. Okay. So at the end, you can do taping of the area. So you can put some taping, some bands to keep on for 3 to 4 days in order to subscribe the product in the area and keep it in the treated area. Help it keep it in the treated area because it will stay there. Okay. So now we're not going to perform any taping, but usually I do it with 3 bands like this in order to block my product and help in the daily activities have more access to the daily routine. Then we will remove them after almost 1 week. Okay, that's it. So now we will ask our patient slightly to get up. Just a second. Are you okay? Okay. Perfect. Hold it like this. Okay. So as you can see, we have a more projection of the upper third of the gluteus, a fuller aspect of the hip dip. I didn't overcorrect, so we can touch it up after 3 to 4 months in order to put some other 3 to 4 syringes per side. So we can get a fuller result, but you can see how much the curve is getting fuller from this side, you see. Okay, perfect. And the bigger projection of the upper part of the gluteus. Maybe here we still have some defect, which is more lateral, that we can assess in a second moment. The result will get better in the next few days. So that's it. Are you feeling any pain?
No.
Okay, amazing. So if you have any questions, I would be happy to answer, or curiosity, or if you want to share any kind of personal experience. Okay, so if that's all, thank you, and do not forget to get registered scanning the QR code so you can get the certificate at the booth. Have a nice day.